Chair will now recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Mr. Chairman, and thank all of you for being here. I have a great deal of respect for your academic achievements and for your expertise in this area, and I thank you for that. There is currently a proposed merger between two companies, Luxaltia, and they are an Italian company that makes eyeglass frames, and another company, Excelsior, which is a French company that makes the lens itself. So here we have a proposed merger between these two companies where they will be owning not only the eyeglass frames, but also the lens as well. And oh, by the way, they will also own iMed, which is the second largest vision insurer in the country. And oh, by the way, they also own retail outlets such as Pearl Vision Centers, such as Lens Crafters, all fine businesses. But now you have this vertical integration, if you will, of a company that owns just about everything in that area. And now they will have the ability to drive market to their different companies. I wanted to ask you, Dr. Daphne, from a free market principle, does this make sense? I mean, is this the kind of thing we need to increase competition? I understand that competition dictating healthcare prices are corporations that dictate prices because they control the market. Which one works better?
I'll be the economist again and say, you know, there are two sides of this, but what you described, the vertically integrated offering, might well be much more efficient than the piecemeal offering. So this could be beneficial. The question is, by combining, are they somehow lessening competition because might they withhold their frames from other purchasers?
And that's exactly why I have a bill. Imagine that. HR 1606, the Doc Access Bill, which addresses this, to address the free market principles and to have competition. Full disclosure, prior to becoming a member of Congress, I was a practicing pharmacist for over 30 years. I have witnessed firsthand the impact that PBMs and the consolidation of PBMs and drugstores have had on patients. Now, this is something this may be the trainee training the trainer here, okay? This is a part that I think that I have seen firsthand that perhaps you haven't seen, the impact on the patient. In my 30 years of practice of pharmacy, I was a retail pharmacist, and I serviced generations of families, grandparents, parents, children, and grandchildren. And I've seen that, and they've become trustful of me and trustful of their community pharmacists, of their independent pharmacists, and you build up that relationship. And I've had them walk into my business when I was still practicing, literally in tears, saying, I've got to go to another drugstore. Mm-hmm. My family's used your drugstore all our lives. My grandparents, my parents, they've used your pharmacies. I've used it for my children and for my grandchildren. Now I've got to go to another pharmacy because my insurance company owns that pharmacy. And they're telling me I have to go over there. That's the real life impact that we see through this consolidation. You've mentioned before that PBMs control over 80, there are 3 PBMs that control over 80% of the market share. Now, if you look at the mission statement of the PBMs, it will say that they are there to lower drug prices. I want to ask you, how's that working out? If it's working out well, Dr. Schulman, why is the president identifying escalating prescription prices as being one of the things that we need to address in this country?
I think, you know, we've been talking about PBMs a little bit today. This is the least transparent business model of any of the things we've been talking about in the country. So in 2015, there were approximately $115 billion passed back from pharmaceutical manufacturers to PBMs and to drug distributors. Some of that was passed back to employers. Almost none of that was passed back to consumers.
And do we know how much was passed back to employers?
We don't know.
We don't, because Dr. Gaynor, you said earlier that sunlight was the best transparency out there. It's the best disinfectant out there. We have no transparency. Dr. Daphne, you said you were with the FTC. Why does the FTC not look into this? Why are they not doing something about this?
The FTC has jurisdiction to do certain things. They could do a study, and one thing we mentioned was a study of the effects of the last transaction that they did not challenge, a big merger in the PBM.
And this is getting worse before it gets better. Now all of a sudden we see where CVS Caremart's going to buy Aetna.
In fact, your description of the dental consolidation sounded very much like that integration.
That was not intentional, but nevertheless, the point that I want to make here is that I think the one thing we may be missing is the impact it has on patients. This does have an impact on patients. When you talk about having trust between a healthcare provider and a patient, that is invaluable. That between a doctor and a patient, that relationship is so hard to build, and yet we have insurance company. And listen, I used to call these guys crooks, and I still do when I get upset. But they're not really crooks. They're smart business people. They're exploiting the system that we here in Congress are not doing our job. We're not making the changes that should be made to prevent this from happening. And it frustrates me.
Well, we've talked about the impact of patients a good bit from a lot of these consolidations. The research that we've been talking about in terms of cost and quality, most of that used claims data. Very little of that actually interviewed patients to see what happens in town when basically they raise the parking price at the hospital to $50.
And you know it does impact them. It impacts its accessibility. It impacts its compliance.
I know your time has expired, but I have to say this, which is patients are an afterthought when it comes, if they even get to be an afterthought, when it comes to discussions of consolidation. I've been privy to a number of them.
Thank you.
Just one last point to reinforce what you said is that all these things interact in a way that makes things worse. So the issues with choice of pharmacy are compounded by lack of choice, lack of competition in health insurance. If folks could say to the health insurance company, go take a hike, I'll go to another insurer that's offering me access to the pharmacy, then you bet you'd get access to these pharmacies. But if the insurers don't have to compete, they won't.
Mr. Chairman, thank you for your indulgence.
Thank you very much. Gentleman from Georgia yields back.